Hi, welcome back to my channel. I know it's been a while I have not uploaded any videos. I'm so sorry for that, but from now on I will continuously upload them. So today's topic is antifungal. So these are extremely high yield topics for USMLE, be it step 1, step 2 or step 3. If you understand these drug classes, their mechanisms, major toxicities and the classic clinical scenarios, you will be able to answer many antifungal questions confidently and correctly. Okay, so these are some of the easiest points to gain on the exam. So without further ado, let's dive in. Okay, so to remember the antifungal, we need to understand what part of the fungus the drugs attack. Okay, so there are 6 major antifungal groups, and these are, one is echinocandins. Okay, so these attacks the cell wall. Pollines, these attack the cell membrane, okay, the plasma membrane. The other one is terbinafine. Okay, these actually inhibit the lanosterol synthesis. Azoles, these are these inhibit the ergosterol synthesis. And there are 2 others, and these are the flucytosine, actually that inhibit the DNA synthesis, and griseofulvin that actually inhibit the microtubules. Okay, so first, to understand that, we need to understand this figure. Okay, so we know that the fungal cell wall is made of beta 1,3 beta glucan. Okay, this is made up of, the cell wall is made up of 1,3 beta glucan. Okay, it is a major polysaccharide component of the fungal wall. Okay, and for the cell membrane, the stability is provided by the ergosterol. Okay, it's similar to cholesterol of our human body. Okay, so for that, the squalene is converted to squalene epoxide by squalene epoxidase. Okay, and the squalene epoxide is converted to lanosterol, and this lanosterol is finally converted to the ergosterol. Okay, and this ergosterol is converted from the lanosterol by 14 alpha demethylase. Okay, so here is the point. So squalene epoxidase is inhibited by what? It is inhibited by terbinafine. Okay, so it can be remembered by terbinafine, squalene, the Q-shaped. So terbinafine actually inhibits the fungal enzyme squalene epoxidase. Okay, or torban, you can remember that's a spiral thing around the head. Okay, that is in a Q-shape. So it inhibits the squalene epoxidase. Okay, the other one is the from lanosterol to ergosterol. Okay, 14 alpha demethylase enzyme. Okay, and these are inhibited by azoles. Okay, fluconazole, itraconazole, ketoconazole, meconazole. Okay, these are all inhibited by azoles. Okay, 14 alpha demethylase. Okay, nowadays even instead of 14 alpha demethylase, it is also been talked about 450. Okay, because it inhibits cytochrome P450. Okay, so it is also said that 50 demethylase. Okay, demethylation. Okay, so that thing should also be remembered. Okay, now the other thing is talking about the cell wall, how to remember echinocandins actually inhibit the cell wall. That is, here we can see Chino. Okay, but we can remember it as China. So China is famous for Great Wall. So it is inhibiting the cell wall. Okay, and talking about the pollines. Okay, pollines is amphotericin B and nystatin. In here only it is tyrosine. So it will tear the cell membrane. Okay, so amphotericin will be tearing the cell membrane. Okay, similarly nystatin, it is also in the same class, so it will also tear the membrane. Okay, the lanosterol synthesis, we have already talked about terbinafine. It's a turbin that is a spiral around the head, so it is in Q shape, so it inhibits the squalene Q. Okay, it inhibits the Q shaped squalene. Okay, and the other one is azoles, it inhibits the 14 alpha demethylase or P450 demethylation. Okay, so that is the azoles. Okay, now the important thing is not just to remember what are the classes of the antifungal therapy, but we also need to remember in what cases they are used. Okay, so these are very important to learn. Okay, so let's say if there is a ICU patient, okay, and the patient is in ICU and the patient has the blood culture is drawn and candida is there. Okay, so the patient has candidemia. So in that case, what we will use is echinocandins. Okay, in the name only there is candin, so it is against the candida. Okay, so that can also be way to remember echinocandins. Okay, so it is against the candidemia. Okay, now suppose if there is HIV patient, if the patient has suppose if the patient is HIV, there is headache. If the patient also has suppose there is elevated CSF. Okay, if the pressure is elevated, okay, that is cryptococcal meningitis. Okay, in the cryptococcal meningitis, what is the drugs we need to give is amphotericin B. Okay, amphotericin B plus what we will be giving flucytosine. Okay, flucytosine is for the DNA, it inhibits the DNA. Okay, it inhibits the DNA synthesis. Okay, so these are given in the cryptococcal meningitis, and after this, after the patient is off febrile, then we will give then we will have maintenance therapy with fluconazole. Okay, the other one is if the patient is like immunocompromised, if he has persistent fever, if there is halo sign on the CT, then that is invasive aspergillosis. Okay, in cases of invasive aspergillosis, we will go with voriconazole. Okay, so these are the drugs. Suppose if there is patient is diabetic patients, his this HbA1c is like 8 and there is black nasal scar. Okay, that is mucormycosis. Okay, in those cases we need to have urgent surgical debridement, and then we'll give liposomal amphotericin B. Okay, so these are very high yield. Okay, and if there is suppose painful swallowing in HIV patient, then that is esophageal candidiasis. Okay, in cases of esophageal candidiasis, we'll go with fluconazole. Okay, fluconazole. But if the suppose if there is an infant, if the infant has white patches in the this tongue, then that is that can be easily scraped off, and that is oral candidiasis. Okay, in that oral candidiasis, it's just a oral thrust, we can just use nystatin. Okay, you don't have to use fluconazole. Okay, that is very high yield. Now the other one is suppose if the patient is with a female of a reproductive age group, and the woman has thick white vaginal discharge, then that is vulvovaginal candidiasis. In that, we again can use fluconazole. Okay, suppose if there is Ohio or Mississippi River Valley, if the patient is exposed to the bad droppings or has been in the cave, then it's a histoplasmosis. Okay, first we can give itraconazole, and then we can go with amphotericin B if severe. Okay, always remember amphotericin B is for the systemic illness. Okay, suppose if there is broad-based budding, is that is obviously blastomycosis. Okay, similarly here also we can give itraconazole if mild and amphotericin B if severe. Okay, suppose if there is a patient whose job is gardening, they won't say typically rose gardener, but if the if they are exposed with the rose thorns and there is nodules spreading along the lymphatics, that is sporotrichosis. Okay, in that we can give itraconazole. Okay, suppose if there is Arizona traveler with Valley River and there is erythema nodosum, then that can be coccidioidomycosis. Okay, in that also we can give fluconazole. Okay, And if there is severe disease, again we go with amphotericin. Okay. If there is like suppose thick allotoneals, that is onychomycosis, we'll go with terbinafine. Okay. And if the patient has like patchy hair loss, scalp scaling, especially in children, then that is tinea capitis, we can go with terbinafine or griseofulvin. Okay. So these are very important antifungal therapy. Okay. The main important thing is to classify, to know in which classes what drugs belongs. Okay, so cell wall is echinocandins. We can remember it with China, and then China is famous for great wall, so it inhibit beta glucan synthesis. Okay, caspofungin, mycofungin. Cell membrane is pollins. Okay, amphotericin, like there is amphotericin, so there is tearing of the cell membrane, so amphotericin B and nystatin. Okay, the other one is inhibit DNA synthesis. These are flucytosine. Okay, flucytosine will inhibit the DNA synthesis, whereas griseofulvin will inhibit the microtubule. Okay, flucytosine actually it inhibit the DNA and RNA biosynthesis. Okay, by actually it what it does is convert to 5-fluorouracil. Okay, 5-fluorouracil. Okay, and that is actually converted by cytosine deaminase of fungus. Okay, so it is converted by fungal cytosine deaminase to 5-fluorouracil. Okay, so this and since it is 5-fluorouracil, you can remember it as an anti-cancer drug, right? So the side effect will be myelosuppression. Okay, it is a anti-cancer drug, so that can suppress the bone marrow. Okay, the other one is Lannister synthesis, terbinafine. Once again, I'll tell it as torban. So in the head, in the shape of Q, so it inhibits the squalene epoxide. Okay, I don't remember any other form to remember terbinafine. So if you have, you can just comment on the videos so that other people also can learn, and even I can learn it. Thank you so much. Okay, then the ergosterol synthesis are azoles. Okay, these are actually 14 alpha demethylase inhibitor. Okay, and these also are P450 inhibitors. Okay, and the other thing of azoles very high yield is they are also actually that is very high yield, like especially ketoconazole. Okay, these are anti-androgens. Okay, anti-androgens, so their side effect is gynecomastia. Okay, so enlargement of breast. Okay, so azoles, it also has a side effect of enlargement of breast. Okay, it inhibits the testosterone synthesis that results in gynecomastia. Okay, and it has liver dysfunction. And the other thing is side effect is it will also prolong the QT interval prolongation. Okay, it also does this thing. Okay, the other thing about, did I miss anything? If I have missed, please let me know so that other can also understand. I think this, yeah. And the other thing is about the side effects of amphotericin B, and that is amphotericin V, that is very high yield, and that can be remembered by amphotericin. Okay, it's terrible for what? Phlebitis. It causes phlebitis. Okay, it also is terrible for anemia. Okay, it actually decreases EPO, that results in anemia. The other one is it also it will also cause flu-like illness. Okay, so there is fever, chills, it is nephrotoxicity, so hydration is very, very important. Okay, and this hydration will decrease the nephrotoxicity. Yes, and the other thing is like it will also cause electrolyte disbalance. Okay, electrolyte disbalance, that causes like decrease in magnesium, decrease in potassium. That's the reason we need to supplement it with potassium and this potassium and magnesium. Okay, because of renal tubule. There is alteration in the renal tubule permeability that will result in the loss of magnesium and potassium. So there will be decrease in magnesium and potassium. So we need to supplement them with this magnesium and potassium also. So the other thing is that liposomal amphotericin is good one because it has lesser toxicity. Okay, so I think this is important. So yeah, these are the only things that I wanted to talk about. So and the other one is, yeah, about the flucytosine. It is always given with amphotericin B, because if it is given alone, the resistance is higher. Okay, the resistance to flucytosine is higher. So flucytosine and amphotericin B is given in cryptococcal meningitis, and after the fever is if the patient is off febrile, we'll go with fluconazole maintenance therapy. Okay, so thank you so much. These are very high yield. I hope you'll match with your dream specialty. Thank you so much. Bye bye.